like to welcome you to our presentation today on Frontline responses to COVID-19, impacts, innovations, and lessons learned. My name is Stan Brown. I'm a member services consultant with the Georgia Municipal Association. In this session today, you'll hear from officials from Dalton, Gainesville, Albany, and Commerce who will provide an overview of how their cities have planned for and continue to provide mission-critical public works and public safety services to meet their community's needs during the COVID-19 pandemic, and also discuss their plans for moving forward. I will have other moderators here today. I will be covering the public works section. Freddie Broom will moderate the public safety discussion, and then Terrell Jacobs will moderate the session at the end that will cover some of the mental health aspects of how we respond during this pandemic. Our two panelists today for Public Works will be Chris Rutowski, City of Gainesville Public Works Director, and Andrew Parker, the City of Dalton Public Works Director. The topics that we'll talk about is planning and preparedness, impact on services, innovations, lessons learned, and moving forward in what we're now referring to as the new normal. Andrew, if you would, please share with us your experience in Dalton with planning and preparing for this pandemic.
Thank you, Stan. Just like Chris, in early March here in Dalton, the city department heads were convened to start talking about contingency planning for the COVID pandemic. This was a little bit different than a normal natural disaster or something like that for us. So what we did is put together some service protocols as it relates to public work services. And we tried to make this something that we could easily share with the public, easily share with the elected officials and our internal city staff to communicate the services we would continue to provide throughout the pandemic, and establish a hierarchy for these services so that we can illustrate to folks which of these we deem more critical and which of these are more deferrable items. The first category that we put these services in was critical services, and these are the ones that we would attempt to provide at all times. These include things like household garbage collection. Here in Dalton, we have a program for backdoor service for elderly and disabled residents. Obviously, we don't want to put those folks at any more risk than they have to be. Cemetery burials and coordination with funeral homes is something that never stops and certainly doesn't stop during a pandemic. So that was a critical service we wanted to continue to provide. Emergency road and bridge repair, stormwater pipe and culvert scheduled maintenance to prevent further failure, traffic signal maintenance and outage response, inclement weather. So we have spring storms during this time period, and those were ones that we still had to respond to, and then removal of dead animals from the right-of-way. The second set of service protocols were desired functions, and what I mean by that are these are the services that we want to continue to provide, but they may have to temporarily be halted during this pandemic situation. For us, unfortunately, we did have to discontinue curbside recycling for a little over a month because early on in the pandemic, there was a lot of uncertainty and unknowns about surface-to-surface transmission. And here in Dalton, we still provide a curb sorting operation where our operators are actually at the curb sorting through recyclables. And so we dedicated those employees, we moved them into an expanded level of garbage collection so that folks who had more waste during this pandemic, we gave them an opportunity to put more out, and that's what we used our recycling drivers for. And also, another one that was big is the community service detail. We had to suspend that also during this to mitigate risk, but it also had an unintended consequence of more litter being on the right-of-way. So these are definitely desired functions, but we wanted to illustrate through these protocols that some of these services may have to temporarily be halted. And then the final subset was deferrable items. These were the items that we advertised to the public that in a situation where we would have reduced staffing, that was our biggest concern, is as this pandemic progressed, would we start losing potentially employees that may get in a quarantine or isolation situation. And so these were the services that we advertised might have to be halted first. Most of these, fortunately, we were able to continue during the pandemic, but this prioritization, what we term service protocols, allowed us to stay on track and ensure continuity of operations.
Okay. You know, one of the things that we've seen nationwide is that solid waste really was and continues to be an essential service during a pandemic. And I know that for both of you, there were a lot of impacts that you saw with solid waste, and just wanted to talk a little bit about that. Chris, you want to share some of the impacts that you saw to your solid waste operation during this pandemic? And then Andrew, I'll ask you to share a little bit about the experience.
Yeah, this was a situation where in our planning, we identified the solid waste service as being our most critical service for this event. So it obviously got a lot of attention, and it wasn't something that we could treat in any of the suspending service or deferrable service type of thing. So we knew we were going to have to address that. It's not uncommon for the springtime to see a slight uptick in volumes of solid waste, but once everyone was sheltering in place and not being able to go out and do the things they normally did, we saw a tremendous increase in our solid waste volumes. They, not just in our household garbage, but also what we call our curbside. People were cleaning up their yards, cleaning out their garages and attics and closets, and our volumes increased significantly. And many weeks we had up to a 50% increase in our volumes of our solid waste. And so not only were we dealing with the concerns regarding the pandemic and staffing of that, we were also dealing with a significant increase in the volume. So it was a pretty challenging event for Gainesville. We thought we may need to suspend some recycling and curbside, but fortunately we did not have to, and we were able to handle those and keep those volumes up. But it was a very challenging task for sure.
Okay, and Andrew, share yours.
Same thing here. We saw a dramatic uptick in solid waste totals. We provide household garbage collection here in Dalton, as well as curbside refuse and brush collection. Some of the same trends that Chris saw, where you have a lot of folks stuck at home, working from home, doing projects that they've deferred, spring cleaning. And then the other big one was online shopping, folks that were doing shopping online or grocery orders online. All of this waste was dramatically increased, and that put an extra strain on our solid waste services.
Okay. One of the other items that was a great concern, particularly at the very beginning of the pandemic, was water and wastewater operations, particularly when there's a shortage throughout the industry of having certified water and wastewater plant operators. I know we had a number of small communities that were concerned, especially after you'd have a staff member that would be exposed to the virus, and then you'd have to put the other ones in quarantine, and you could find yourself without the ability to operate. One of the things that we saw in talking with communities throughout the state that was very effective was to have a backup plan, either have a relationship with another community, a nearby community. For example, in Hall County, I know Gainesville reached out to some of the smaller communities there in the county to offer assistance if needed. They basically got a familiarization of the plant operations at those smaller communities and were ready to stand up if needed. Also, I know communities like St. Mary's have privatized their water and wastewater operations, and that helped them, but they also had a backup contractor who could provide operations if needed. So again, just having a good backup plan gives peace of mind to the community. Another thing that we've seen in water and wastewater, and it goes really across all the services, is cross-training of staff. When you have street and drainage employees that can do water and sewer line repairs, that's just a plus and an added benefit to the community to be able to deal with staffing needs, particularly when you have a pandemic going on. I think that's a great rundown on what we've seen in terms of the impact to public works services. Let's kind of talk a little bit about the innovations that that you saw along the way? I know there were a lot of things that we learned and were able to react to. If you would, let's start off with this, Chris. You want to kind of share this, some of your thoughts here, things that you
Sure.
learned,
Uh,
with?
really establishing what your priorities are, what our priorities were for this event and continue to be. And pretty much you're defining the expectation for how you're going to respond to it, what your expectation is for staff, what the expectation of city management and citizens can be for the services that we're providing, really defining those essential expectations was really key and critical to trying to manage this. Of course, all while trying to maintain a safety and look at how you can distance employees and if you can limit them as far as the number of employees and vehicles, how to sanitize those vehicles. And one positive thing is what we call the ghost town effect. And that allowed us to do some projects that otherwise would have taken longer because we had better access and we had limited traffic. We were able to do some resurfacing projects that really would have taken much longer and been much more challenging logistically to get done. But with the reduced number of people on the roadway and out and about, that really let us speed that project up and move forward. So there was a little silver lining to this in that we were able to use that ghost town effect and really get some things done that were beneficial.
Okay. Andrew, share some of your innovations that you saw there in Dalton.
Thank you, Stan. I think that we can all agree that the pandemic forced us to embrace technology like never before as a way to not only communicate, but to conduct meetings. The business still has to occur. We just had to be more strategic about how to do it and do it safely. So for us, that meant, limiting staff coming in and out of the office. We closed the buildings to the public at one point, and we communicated with them primarily by telephone or by appointment. It reminded us that nowadays you almost have to have a smartphone to be able to communicate, whether that be through email, text message, and I'm talking about even on the frontline supervisor level. And fortunately, we already had those smartphones in place. Here in Dalton, we have a work order system, electronic, which helped to have that in place already. And it's twofold. It allows us to place work orders in that are called in, but also citizens have the ability to go to the website and input a work request order that gets immediately routed based on whatever category it is to the appropriate supervisor. And then finally, we've used meeting softwares similar to the platform we're on today to conduct virtual meetings where necessary, whether that be internal meetings or meetings where we were open to the public. Another real great innovation that I'm proud of here in Dalton is our Ready to Work program that was created during the pandemic. And what this allowed us to do was put together an innovative staffing approach. Many other communities, I think, took this approach as well. But what it allowed us to do is stagger work shifts to mitigate risk of spread. I'm a baseball person, so what I say is it gave us a bullpen of reserves. Basically, we took all the divisions within public works except for sanitation, and we reduced those divisions down to 50%. For about 3 weeks, we had like a team 1 and a team 2, and what that allowed us to do is have that bullpen so that if somebody gets sick or they have a family member that gets sick, we don't lose all the workforce in one fatal swoop. So that was an innovative takeaway that we have to use in other situations like this. And then finally, the effective use of social media to communicate messaging. It was a great venue or medium to be able to share the critical services performed by public works and local government and get those out to the public. I've got a couple of examples here that were prepared by our communications team. And really what we wanted to try to do is communicate the message that we're still here working for you. The first graphic showed a flood mitigation project that was taking place during the pandemic. We were having a couple of businesses actively flooded by an undersized pipe, and we were working through the pandemic to get that replaced. Our traffic division is still out making sure that the signals are good, in good working order. Garbage collection still being provided. We truly are, a lot of the services provided by local government are critical. And this was just a way to connect that message to the public, especially during this time. There's a link at the bottom of the slide that's currently on the screen where our communications team put together a little video of several of these photos. And we got a lot of great feedback from the public about continuing to provide this service in a period in which there was very little activity going on other than at the local government level.
Okay, so that leads us into lessons learned. Chris, you want to share some of yours?
Absolutely. I've been through a lot of different events. I've never been through a pandemic, so I'm continuing to learn a lot and try to look at it in that fashion to take the opportunity to learn new things. Of course, it was very confusing at the beginning of this, and there was confusion in regard to different rules and guidelines that were coming out. And so trying to accommodate and learn and just really soak all that in was a bit of a challenge. And so with those things, as they changed, one of the key things I'd really like to focus on is identifying being flexible. We had a template in place, as I mentioned, with our emergency plan, but being flexible enough to change that and be able to move it around and pay attention to the things that are happening outside of my small sphere of influence and world, to be able to recognize, hey, I need to change this and move to that. And with that, have the opportunity to use some outside the box thinking in how we approach some of these challenges, whether that was making sure we had PPEs for our employees or being able to disinfect buildings and things like that. Really being able to think outside the box and use that. And of course, utilizing our relationships with other people in the world of public works. Andrew and I talked through this. I talked with several other public works directors and other people I know from the state and county, and really keeping those relationships in that blue sky condition really helps in the time of crisis, because you can quickly bounce ideas and get feedback. And so that was definitely something else that was reinforced from a learning perspective of knowing your resources and who your resources can be. And learning how to improve communication in challenging environments. Some of our frontline, employees don't have the same amount of technology or emails and things. So learning how to do that and getting those messages across was definitely something that was also challenging, but we learned from and were able to move forward. So there were many lessons learned, and I'm sure there'll be many more to learn as well.
Okay. Andrew, you want to add to that discussion?
The key things for me, as Chris said, there's so many lessons learned. I think one of the ones that was important to me was trying to maintain morale. It's tough when everybody else is at home and you're still out having to pick up garbage. And so for us, we recognize that the employees are the lifeblood of our cities. Without them, it's impossible to provide these services. And so we tried to do some unique things like prepackaged meals. We had a lot of local restaurants in town that business was slow, so it gave us an opportunity to do some prepackaged lunches every once in a while, just to send a message to the employees that we recognize that you're here during this challenge and we appreciate what you do. We've also had an opportunity to reward a couple of divisions who have maintained service throughout the pandemic with a little bit of hazard pay. It's not a tremendous amount, but it's enough to say, hey, we recognize that you're here and we appreciate what you do. A key thing for me, and we're still working through this today, is establishing a PPE cleaning product stockpile for future use. We've all heard that there's a chance that this particular pandemic could manifest again in the fall and winter, similar to flu season. And so I think it's critical for us, as our resources were depleted, to build those back up responsibly, not competing with the medical community, but have it ready, because we know we've got to be here just like we were through this pandemic. It reminded me how critical community service and inmate labor details are. I mentioned the example about right-of-way litter pickup. We started to see more and more litter on the right-of-way as a result of not having those two functions going during the crisis. And then, one key thing to do, even in a pandemic or a natural disaster, is to document through the process. Have a note taker, somebody that can basically observe what's happening, and it allows you to amend your plan in the future moving forward. So those were the lessons that I learned.
Okay. So we've talked about the impacts that you saw on the public works services throughout this period. You've reflected on the innovations and the lessons learned. What do you guys see in terms of moving forward? And maybe just kind of wrap up your thoughts about this whole experience. Chris, let's start with you.
Yeah, the new normal. Everybody kind of has put it in that phrase or something similar. It's like you hear getting back to normal, but the reality is it is a new normal. And really, some of the things moving forward is to pay attention to the changing world, paying attention to the new normal, and then being flexible to adapt to that, whether that's with the plans and procedures that we have, or whether that's with our people and utilizing them to the extent that technology allows us to do more teleworking and more video conferencing and things of that nature, so that we don't have to have all of everyone sitting in the same space all the time. And then being flexible with our responses, whether that's to our citizens and customers, whether that's to our fellow employees and other departments. Really, for me, having that flexibility and knowing that when you define the expectation, then you can meet that in a lot of unique ways to really meet whatever challenge comes along, because our new normal today very well may not be the same new normal tomorrow or next week or next year. So that flexibility is going to be significantly key for us.
Okay, thanks. Andrew?
In addition to the lessons learned, one takeaway that I have is that it's given us a sense of confidence about managing during a crisis. And as Chris said earlier, very few of us have been through a situation like this where you are not only having to worry about your employees, but the public, and providing these critical services that we talked about. And so I think since we can see a little bit of the light at the end of the tunnel. We're a little bit battered and bruised from getting through this process because we've never faced it before. But the great thing about it is it gives us a great sense of confidence moving forward to be able to know how to continue services. And it goes back to the planning that we talked about, the protocols, being able to communicate very effectively with the public so that there's no lapse in service. And so I'm proud to say that as we come together as throughout the state as local government officials, that we'll have a greater sense of confidence moving forward if we're ever faced with a similar situation.
Okay. I want to thank you both for being with us today and to talk about your experiences with Public Works during this time of crisis. And both of you will be available to stand by toward the end for questions when we get to that point. At this point, I'm going to hand it off to Freddie Broom, who will talk about the experience of frontline response in the public safety sector. Freddie?
Thank you, Stan. That was a great presentation on Public Works. And so the next segment that we have as far as our frontline response to COVID-19, we have the public safety, where we would talk to representatives from the police department as well as the fire department. Okay, so today we have police chief from Commerce, and we have a fire chief from Albany, Georgia, and I'll allow them to introduce themselves. If you can go ahead, we can start with you, Chief Artis.
Yeah, sure. Thank you. Like I said, Commerce Police Department, we currently, under my scope of authority, we have all law enforcement services for the City of Commerce. We have animal control and code enforcement that we provide here to about 7,000 residents. We are a pretty growing community in Northeast Georgia. We've got a lot of industry that's moved in here within the last year, so we expect that number to grow substantially over the next few years. Currently, right now, we have about a square mile radius of about 12 and a half miles that we're responsible for. We have 28 full-time employees, and we have a budget of about $2.2 million to operate on.
Okay. All right. Chief Scott?
Yes, the Albany Fire Department provides fire services, 911 communications, and emergency management for the city of Albany and Dougherty County, Georgia. We serve a population of approximately 89,502 people. Our coverage area is 335 square miles, and we're located in Southwest Georgia. We have a full-time contingent of employees of 216. We have 11 fire stations and a budget of $17.3 million.
Okay. All right, thank you. And so your department oversees fire, 911 communication, and emergency management, which is great because now we actually get to get a perspective of, in addition to fire service, other important divisions within that public safety umbrella when it comes to emergency management and 911 communications. So public safety response to COVID. I have over 24 years experience in public safety, and this is the first time I've seen a pandemic like this or experienced something like this. And I'm sure that it has been challenging for both organizations. So we want to kind of talk a little bit about what was your law enforcement response to COVID-19?
Sure. One of the things that we really had to have, and then just talking to some of my peers here in Northeast Georgia, is we had to have a totally different mind shift, meaning that we usually try to be proactive, whether that is out stopping vehicles or that is just getting out and meeting the community where they're at. And so we had to pull back a little bit from being proactive because as information came in, as many of you know on the panel, the information wasn't always clear on either how COVID-19 was transmitted, how you got it, what it looked like. There was some, I guess early on, there was some questions about how long it would possibly dormant inside of a host. And so we had to take much more of what we call a reactive approach to policing, meaning we kind of had to pull back a little bit on some of the things that we did, connecting with our community and working with our community. And so one of the first things we had to do is, Freddie, as you mentioned a few minutes ago, you have, I think, what you say, 24 years in 24 years in public safety?
Yes.
And so, myself, I'm right at almost 23, and I have never experienced anything like this in my career. And so we had to develop a pandemic response plan for our department and for our city, something that we didn't have in place. And so that was very important for us to get out and create guidelines for us to start using. And so that's one of the first things we did. It's actually a 3-phase guideline that we created, not only for the city, but also for the police department, on how we would respond in certain areas, depending on how this pandemic changed over time. And so we looked at how we could protect our employees from exposure, but still be able to manage and do the things that we're required to do from a law enforcement standpoint. So some of the things we did, we worked with some of our partners in the county, the sheriff's office. We worked with our 911 center. We looked to reduce the amount and types of arrests that we made to limit the exposure to the jail. We certainly didn't want the inmates that are currently incarcerated to be exposed to this. And so we limited what we arrested for. We also limited what we actually answered calls for. Pretty much, you call for a barking dog, we're going to come out. Noise complaint, we're going to come out. Some of those things we started to change to handle over the phone. The way we did business as far as coming in needing reports, we changed the ways that we did those. We don't charge anymore. We started sending emailing reports out. The way that you pay a traffic citation, we changed those ways. We created more options and more flexibility to do those things. And so, unfortunately, we created basically a social distancing from the community to an extent to try to protect our officers as much as possible and to protect the public. Because, I mean, if you think about it for a minute, if a law enforcement officer got exposed, he or she may have it up to, and someone correct me if I'm wrong, it could be dormant somewhere between 11 to 14 days. Well, that's a lot of folks that we can come in contact with in those 11 to 14 days if we're doing our jobs. Fortunately for us, our community saw a reduction in need for services, calls for services. And so that helped us also. But, we did some things where we put out PPE packets to our employees, and we showed them how to use those things so they could protect themselves if they had to go out to a certain type of call. Courts was a big thing for us. We suspended all courts for probably almost 3 months now, and so that will completely look different in the future moving forward as courts begin to start back up here in June and July. So that was kind of just a brief overview of kind of our initial and law enforcement response to the COVID-19.
Okay, thank you. So Chief Scott, I know with Albany was actually one of the first cities, to be designated as a hotspot. What was your response to the COVID-19? And you had one of the few chiefs in the state that can actually speak on behalf of fire, communications, and emergency management. So, what was your response to the COVID-19?
Well, thank you, Chief. I'll move pretty quickly through all three so that I'll make sure I have time to address all three. From a fire services standpoint, immediately we had some PPE availability and use concerns. That was of utmost concern. Firefighters and leadership very concerned about responding to the public, taking care of the public, and also being as safe as we could in doing it. We also had response challenges as well, because in the early stages of COVID-19, personnel was very concerned about notifications and whether or not they would be notified if someone, if they were responding to a residence of someone possibly with COVID-19. What do I do? What type adjustments do we make to our normal response according to the challenges that we were seeing? And as you mentioned, we were very hard hit initially when everyone was still trying to figure out how to respond. We were dealing with it on a daily basis. We initially we had social distancing in fire stations and on fire trucks. One of the things that we had to do was practice social distancing in fire stations and ask our firefighters to wear masks in the stations, to socially distance themselves. If you're in a fire truck and you're moving from one location to another, it was important that firefighters were masked up. And we did that, required them to wear a mask when they were riding together. Also, one of the big concerns was policy development. We very, very quickly on had to figure out how do we report employee exposures. Being in an environment with firefighters so closely quartered together and living together in the fire stations, riding in the fire trucks together, how do we report that? So we had to work very closely with our human resources department to develop a policy of how do you notify people that they have been in contact with someone who either has been identified as being positive for COVID-19 or they've been exposed to someone with COVID-19. So how do we go about doing that? We had to very quickly put a policy in place to do that. Also, we had to develop some contingency staffing plans. We started reviewing plans for, because early on our community was hit so hard, so fast, we became concerned if we would be able to have the necessary staffing to support our mission. And so we had to develop plans for how would we respond at 50% of our personnel? What would 40% look like? How would we respond? How would we staff our trucks and still respond? So we had to put those contingency staffing plans on the table and begin to discuss that. And then a big challenge in the fire stations and the trucks is cleaning procedures. Very quickly putting in policies so that the station is cleaned and sanitized and trucks are cleaned and sanitized. So that became a big issue for us and as we work through it. Now, from a 911 communication standpoint, social distancing in the 911 center and how you arrange your telecommunicator in the center so they can still maintain social distancing. Also, PPE use. How does one wear a mask in dispatch? We very quickly found out that trying to dispatch and wear a mask was not going to work. And so what we needed to do is make sure that we maintain social distancing so that our 911 telecommunicators can do their job effectively without wearing a mask when they're trying to communicate to our first responders. Also, after a little while, we began to experience more concerns from our first responders because when I say we are the 911 communications, we provide 911 communication for the entire county. So we dispatch for police, fire, EMS, law enforcement as well. So it became an issue of very concern too from all of the first responders of notifications. And so what was developed is a policy for notifying first responders that they are en route to an address that has been flagged for COVID-19. Once we were able to put that policy in place, that gave us a great deal of, allowing us to further reiterate to those responders that they were approaching a residence with COVID-19 and to be aware of that and to have a heightened sense of awareness. So we were able to do that from the 911 center function. We, as a community, put a local state of emergency in place and activated our emergency operations center. But in doing that, we had some very unique challenges, and I'll talk about how we address this later in innovations and how we addressed it. But one of the things we did, we had to operate the EOC virtually. We began to operate it by being physically present in the Emergency Operations Center, and we moved away from that, and due to the help of our TAC department, which most of you call IT, they were able to assist us in setting up the EOC to run virtually. And also, another challenge is when you run an EOC virtually, then how do the emergency support functions work? So on and so forth. So hopefully, what we experienced hopefully helped others as they had to address COVID-19.
Okay, thank you. And that's a good segue into our next lessons learned. So we'll just let you go ahead and continue, Chief Scott. What are some of the lessons that you learned from your response?
Really, I think it is to keep it very to the point. Communicate early and often. I think communicating early and often is a key because in this particular pandemic, COVID-19 was something that people really didn't know anything about. No one had heard of COVID-19. We had to begin to answer the questions of what is it, how is it caused, how does it spread. We were experiencing this. We were being affected so heavily during a time when the experts were working their way through it. And so what I found is one lesson learned is to, when you find out information, any information that you have, continue to communicate that to your first responders, to the public, so that they have the latest information on what you're seeing, trend, how many people have been tested, how many people have COVID-19, what is the recovery rate for people, how many things such as how many ventilators do you have, is there a need to make requests for resources for the community, which we end up doing, making a number through which many of you probably have heard of. The state's way of conducting business for resources is done through something called Web EOC, and those requests are made through Web EOC. So it's important to communicate with your local hospital to make sure that you understand what their needs are, so that you can work with their team to make sure those requests are sent to the state so that those resources can be quickly gathered together and brought into your community.
All right, thank you. Chief Artist, what are some of the lessons learned from your organization or just even in the profession itself?
Well, we mentioned earlier flexibility, and that was one of the key things that from a law enforcement standpoint that we had to be. Information that came in, it seemed like different information was coming in on a daily basis. And so we had to adjust what we were doing in our communication and how we were going to respond to different things based on flexibility. One of the things is that we realized is that no one plan fits all. You have, for example, Albany is quite much larger than the City of Commerce. And so they have different resources than we do. One of the things that we found, because we are a smaller agency, one of the issues that we found is that we didn't have a lot of PPE. And then trying to purchase PPE at the time of the pandemic can be problematic, simply just due to the cost and the demand that exists out there. So, for example, we got emails on a daily basis from companies that wanted to sell, but you're looking at an average of anywhere to $3,000 to $5,000 to make a purchase from those companies. So for us as a small agency, that's just not an option. And so that's really where the state stepped in. Our EMA director here in Jackson County was a huge help for us. He was able to secure resources for us as far as PPE, and we were able to stockpile some of those things here for us. From a financial standpoint, the money really wasn't there. And so we had to find creative ways to do that. And as I mentioned, EMA was a huge part, but also our partnerships with the private sector, with the public and private sector. Our businesses contributed a lot of things to us. It was amazing to watch just simple citizens that would sew masks together and bring them in, or make homemade hand sanitizer and bring those in for us. And so we were able to get a lot of those things that we need. But as I mentioned, flexibility is huge. One plan doesn't fit all. The plan for Albany may not work for Commerce, and the plan for Commerce may not work for Albany. And so recognizing that right off the bat, that each city is unique in their own ways, has their own challenges and struggles, and their own needs, and being able to be flexible enough to meet those. One of the lessons learned is that we had almost zero training in the proper use of PPE. And so that was kind of a challenge somewhat to learn how just to take gloves off to where you fold them inside of each other so that you don't contaminate yourself. And even the issue of how to put on a mask or take off a mask, when to use those and when not to use those. Of course, on the fire side and EMS, they have an opportunity to use a lot of those things that we don't. And so just training your folks in order to be able to do that is something that we're going to need to do more of in the future. But that's something that we have to do better here in the City of Commerce.
Thank you. Yeah, that is interesting. You talked about training because when the pandemic kind of first hit, I was still the fire chief in City South Fulton, and I remember helping hand out masks to the police department. And then as soon as I was handing out the masks, the first thing I had to do was talk to the police chief, say, we need to train y'all on how to wear these, because I'm seeing police officers with full beards walking around with a mask on, and I guarantee they're not getting it properly sealed. And you mentioned, how important it is just to move forward, and that's a good segue into the next what we can talk about. And I'll let you continue to talk about how do we move forward. I know a lot of times people talk about, we're ready for things to return to norm, but I don't know if there's a such thing as returning to norm. I think we're starting to see our new normal in public safety. So if you can kind of talk a little bit about as we looking forward into the future, what are some of the things we need to be looking at, and how have we prepared ourselves to continue to provide these services in the future?
Absolutely. One of the things I think that we are somewhat better prepared for moving forward, again, all of these things are part of lessons learned, but they're all also areas that we have to continue to move forward in to make sure that we're ready for the next response to a future pandemic. Again, resources. we have some resources now. We understand how to use some of those resources, not just simply PPE, but also with the working through communications on a local state level. How do we request resources? How do we communicate with public health? What is public health able to bring to the table? What are they able to provide for us? On a state, what is the state's responsibility? What is the federal government's responsibility to these types of pandemics? And so it's given us resources and plans that are already in place. As mentioned earlier, it's important to have those relationships before something goes bad. And so having those relationships before this helped us through it. But the relationships that we built during it will help us move forward and be better prepared in the future. Again, it goes back to training. We have to be better trained. That is something looking forward, that we need to understand more about pandemics. We need to understand more about how we can be hosts and carriers. We need to understand how we can protect our community better. Some simple things that we can do. What can we do as an organization to protect our community? Again, resources stockpiled. Physically having the resources of PPE on hand in order to be able to get us through that initial surge, or at least through the surge, until our partners, state and local and federal partners, can come on board to help resupply our stockpile. But having that stockpile available. Again, better communication on state, local, federal levels. I touched on that a minute ago. It's all about those relationships. And as Chief Scott mentioned, in Albany, it's about knowing the hospital staff, having their cell phone numbers, having that communication with those folks. That's something that we have to work on. I think we did a okay and pretty good job on it, but we can do a better job in the future with communication and how we're all working towards one goal. Again, social media, I can't really say more than I have already, but just using the power of social media, that gets your message out so much faster and quicker than simply just sending an email or posting a note in the newspaper. Social media is almost instantaneous, and it's huge for us. And again, building more private partnerships and public partnerships in the future. Certainly it was very helpful at this time, but certainly I think will be even a greater help in the future if we happen to see any of these future pandemics. Again, those are just kind of just a few thoughts moving forward. Of course, there's many more things that we could talk about and what we can do better corporately. But those were just a few of the, 6 things really that kind of just, that I thought really stood out.
All right, thank you for sharing that. Chief Scott, what about in the fire service?
I think looking forward, I think a renewed respect for the dangers of being exposed to deadly viruses. I think that needs to be a part of our mindset, even as we move beyond COVID-19. Remembering, if we go back to the way that our teachers and parents and taught us many years ago about good hand washing, good hygiene practices. We have really have to dedicate ourselves to that more. Cleaning commonly used surfaces more. Just a heightened sense of awareness when it comes down to personal hygiene and keeping things clean. And I think that it is so easy, we know now, to be exposed to a deadly virus. It's just very easy to do that. And so I think going forward, I think we're going to have to continue to train, continue to study, and continue to be aware of the dangers that are out there that can affect us, whether we are working as first responders or even in our personal lives. We're just going to have a renewed focus. Over 1,800 cases in Dougherty County, COVID-19. Almost 150 people have died from this. We're not going to let it stop us. And I appreciate you giving us an opportunity to present, to be a part of this and talking about this city and county that I love so much. Thank you.
Thank you. Thank you again, Chief Artist and Chief Scott, for participating as presenters. We've learned a lot from this, and I want to personally thank you for your leadership that you provide for your organizations, for your community, and across the state. And thank you for your services as well. So we finished up the public safety part of it. The next part is what I say probably is the most important part of public safety is the mental health component, because to do these jobs as first responders, we have to be physically and mentally fit to do the job. At this time, I'll turn everything over to Terrell Jacobs, and he will talk a little bit about the public health side of it. Terrell?
I want to introduce y'all to Dr. Myers. I was just speaking about, I saw on her bio that she's a Florida State University grad, so go Noles, go Noles. So definitely going to give her a shout out about that's one of my favorite college teams. So anyway, we're going to hand it over to her and let her talk about how this has impacted our employees from a mental health aspect now and then thereafter.
So I think when we're talking about COVID and first responders and their mental health, as well as other folks' mental health, the difference between other stressors that first responders have had to deal with in COVID is that this is really an invisible stressor. And we, as other panelists have discussed, we didn't know how it was going to affect us, when it was going to affect us. And especially in communities of color, there was a heightened amount of fear and threat because people were watching loved ones get sick and die at greater numbers. And so, the folks who are your first responders, they have family, they have friends, they are human. They're going home to those invisible stressors as much as, or possibly more than some of the other people in our communities because they're exposed to what those stressors mean on a day-to-day level. And it affects their body. It affects their mental and physical and spiritual health as well. And so, coming into this event, we didn't know what was going to happen. And that just amplified some of those threats that certain individuals could feel based on not having enough information and not really understanding what was happening. And what we know about mental health is that when we perceive a threat and we don't have information, we make up information. And when we make up information, we tend to not make up information that's helpful. We perceive things as more dangerous because we don't know. And that's to keep ourselves safe, but it also has an effect on our mental health if we continue to ruminate about those thoughts or be exposed to those kinds of situations.
So Doctor, talk to us a little bit about the anxiety aspect of it and, how long, potentially from your perspective, how long of this, these mental health issues will linger or carry forth, even as some of these, cities, return all their employees back to work and things of that nature, and the potential of a fall, continuation of this pandemic. So talk a little bit about that.
Sure. I think anxiety is actually another natural response to difficult situation. If we didn't have anxiety, we wouldn't be fearful of crossing the road when cars were coming by. We need a certain level of anxiety to survive and to do well. But when we're exposed to stress and repeated stressors, that high level of anxiety can take over. And that's when you have, especially for individuals who before the pandemic had struggles with stress and anxiety and depression, the experience of COVID is just amplifying those previous concerns. And so, the true answer, unfortunately, is we don't really know how this is going to affect each person. We know it will affect each person, but we know that stress and anxiety affects each person in a different way. So one way it can affect individuals is through, physical responses like headaches, stomach aches, and physical ailments, and they get sick more often. So you may have employees that are constantly calling out sick, but it's really because of a stress response. It's really connected to that. Or you may have individuals who are struggling with irritability and anger issues and easily frustrated and snapping. And of course, nobody likes to experience that at the workplace. And the behavior is not appropriate. But if you think of it in terms of a stress response, it helps you to be more empathetic and say, hey, not what's wrong with you, but what's happened to you? What's going on? Are you okay? So if we can kind of help folks to see that that's a part of their stress response, and that's how they're trying to cope, then it's helpful. And then we can also see, unfortunately, that severe mental health issues can come from this. If we have a history of mental health issues, like depression, anxiety, or PTSD, these traumatic experiences or perceived traumas that folks are going through right now and possibly into the future can just exacerbate those conditions, and those can happen, again and come up again. And so I think, it's just a lot of unknowns and a lot of it depends, but it's pretty clear that this amount of stress will have an impact physically or mentally on first responders and really everybody, all of us. It's having an impact on all of us.
Mm-hmm. Well, one of the things that a lot of cities may be struggling with, and I want to get your perspective on this as well, especially in frontline individuals who are predominantly male, and come from the macho mentality of it all,
right. Right.
The stigmatism of seeking mental health assistance. Talk a little bit about that, because I think a lot of times, even some of our local officials don't appreciate at times the need and the stigma behind that, and how they can hopefully open up some pathways for that.
Yeah, there's no question that stigma is an issue, not just for men, but for communities of color as well. You can reach out in ways other than a mental health professional. You can reach out to a spiritual or religious person that you can connect with. You can reach out to other people in your profession that have gone through what you've been through. What's interesting is in the previous set of slides, part of the lessons learned was for both the fire and the police were ask for help. So we're saying ask for help as an organization, but somehow there's a stigma to ask for help as an individual. And that really needs to be addressed at that level of, if we need help to function and be flexible and to operate during times of stress as a larger organization, we need that as individuals too. And so I think if you put it in that sense, if you build awareness, if you share information, if you bring in, folks to speak about how the stress response is something you can't control. This is a part of your body. This is what helped us to not get eaten by lions and tigers and bears, is to have a stress response and fly away and hide. And so even if you're a first responder, no matter how hard you work physically to be prepared for that job, you cannot control the amount of how that stress is going to impact you physiologically. It just does, because that's how our bodies are built. And so I think if you can talk about it in that way, it can take away some of the stigma of weakness or, I'm not strong enough to withstand this. Well, none of us are. None of us are built like that, unless you're a part of the Avengers. I really don't know. And even some of those folks, are not able to withstand that stress. So if Tony Stark can ask for help, then I think our first responders can too.
Well, you hit the nail on the head. Tony Stark was one I was going to mention, so you hit it just right. So let me say this in closing. I want to ask you this: we have mostly with us watching today, which is elected officials that are going to be taking in this session. What's the takeaway that you would share with them to embrace, to hopefully own and show sense of leadership to help their employees, specifically these frontline folks, appreciate that you give us a thought on?
I think that's one, the fact that you're having these conversations, which I think we talked about haven't really happened in the past here. I think that's a good first step. I think, more time talking about these things, The reality is that 1 in 4 individuals in their lifetime will have a diagnosable mental health condition. So it's more of the norm than the exception to have employees that experience this issue. So we need to have a paradigm shift of, this is going to happen. This is going to affect the people that work for me and probably myself. And we need to acknowledge that that's more the reality than, the other side, which is, only those who can't handle the stress are going to experience this. That's absolutely false. And then, break down those barriers of stigma, provide access to services, not make it a once a year conversation, but, a more frequent conversation, build relationships with the center. There's a Center for First Responders of Excellence where they have a behavioral health component where you can get resources and training and speakers and folks who are first responders to come in and talk about and share their stories to reduce that stigma. Mental health affects performance at people's jobs. So if you want to have a good workforce, you need to address mental health as much as you need to tell people to stop smoking and to get more physically fit and to not use drugs and alcohol on the job. It's a part of workplace safety and functioning. And so we need to embed it into all of our policies and all of our practices, that this is an ongoing conversation that doesn't just happen once a year or when something bad happens and we feel like we need to address it.
Well, thank you, Dr. Meyer. I appreciate you sharing your insight about the whole issue regarding mental health, especially during this pandemic, dealing with our employees across the state. I hope some of our elected officials and staff who are watching this, and hopefully will have questions for you and other panel. We want to thank everybody for presenting today, and from the public work side, public safety side, and from your perspective from the mental health side. So we're going to close out, and hopefully we'll have a little time at the end for questions. Thank you.
Thank you.